20 minutes of live harp music were shown to decrease pain and anxiety in post-operative vascular and thoracic surgical patients in a controlled pilot study performed in 2002 at Orlando Regional Medical Center.
30-minute interventions of live harp music provided by Tammy Briggs in a pilot study of 61 oncology patients at United Hospital in St. Paul, Minnesota, also gave evidence that harp music played at the bedside of hospitalized cancer patients may reduce anxiety. Although the small sample size did not reach statistical significance, there was a trend for decreased anxiety in the music intervention group compared to the control group that received no music. Patients who received the intervention had decreased respiratory and heart rates compared to the control group. 4 hours later, the heart rates of subjects in the intervention group were still lower than the control group. During 2004 and 2005, harpist Sunita Stanislaw participated in a study at Meir Hospital in Kfar Saba, Israel. She and Eliana Gilad spent 100 hours playing music in the neonatal intensive care unit.
The study, directed by neonatologist Dr. Shmuel Aran, was designed to measure the effects of live, recorded, and no music interventions on healthy newborn babies born after 32 weeks gestation, weighing at least 1,500 grams.
The CD recording that was used included music of Eliana on voice and Turkish frame drum, and Sunita on harp, accompanied by an Arab violinist. The soothing music mixed Eastern rhythms with Western harmonies. The 30-minute live music interventions used music similar to the music on the CD.
Heart rate, respiratory rate, oxygen saturation, and behavioral assessments were recorded every 2 minutes before, during, and after the intervention, allowing 30 minutes for each interval. The live music intervention had no significant effect on physiological and behavioral parameters during the 30-minute therapy. However, at the 30-minute interval after the therapy ended, the live music intervention significantly reduced heart rate and improved the behavioral scores, one of which was deeper sleep. Recorded music and no music interventions had no significance on any of the tested parameters during all intervals.
I'm Dr. Paul Levy, and I'm a cardiothoracic surgeon here at the Heart Hospital, New Mexico. I'm also the surgical director, and here at the Heart Hospital, New Mexico, we have used Harp therapy for over 9 years, and we have been very, very satisfied with what we've seen when using this form of therapy. We've had patients in the waiting area that have been very relaxed during their wait for their loved ones in the operating room. We've also had post-operatively, we've had patients that we've seen their vital signs markedly improved. We've seen decrease in heart rate, we've seen decrease in blood pressure and respiratory rate. More importantly, we've seen more relaxed faces of the patients. Preoperatively in the holding area, we've also used the Harp, and has been very effective in relaxing the patients before they undergo their operative procedure. The difference between live and recorded music is twofold. One, you have the presence of the musician, and second, you have the resonance of the instrument. With the presence of the musician, you have the face, you have the touch of the musician to the patient, and you can see all this in the patient's face. The family is so appreciative. The second thing, the resonance, it's beyond science. Again, there is something happening which I can't explain.
I'm Sue Hoadley. I'm a music practitioner. The Heart Hospital, again, really uses the music as an integral part of the care plan. In fact, one day I got a quick message from a nurse saying, "We have a harp emergency in the recovery room. Could you come right away?" And I work in a hospital that is called a long-term acute care hospital, where patients may be confined to their bed for months. it brings them, it allows them to go to other places, to go into their fantasy world, to go to a beautiful meadow and see things that they don't see in the hospital. It softens their environment.
And as the surgical director, I feel that I don't want to move forward in my practice without having HARP therapy present.
I saw firsthand the effects that it had on patients almost immediately, and from the very first experience, walking into a hospital room where a man was on a ventilator for a long time, and it was the first time the nurses says his breathing settled down, his blood pressure went down, he smiled, and his wife just broke out in tears, said it was the first time she saw him smile in weeks. And I realized that your program wasn't a flavor of the month. This was not about, oh, we'll come and play for the patients. That this was something of depth, something that was really connected to the work of healing. You don't go anywhere or step foot in a building unless you're competent, whether it be for medical records, as a secretary, as a nursing assistant, as a nurse in a telemetry unit, oncology unit, ED, whatever. Everybody has their competencies, and that's the type of people that work in healthcare, people who are ready to commit themselves to education and to supervision. You know, number one thing in medicine is do no harm. And a good part of our work in quality and in safety is protecting our patients. In pastoral care, we do that all the time. So to have people that are being trained for this particular setting is very reassuring.
In 2006, the Southern California Cancer Pain Initiative honored Lynette Edelson for her role as founding director of Compassionate Harps. The award highlighted her work with the harp for the relief of pain and suffering of cancer patients.
Compassionate Harps provided in-house training programs for harpists and provided harp therapy at facilities such as Inland Hospice, Pomona Valley Hospital, San Antonio Community Hospital, and Pilgrim Place Health Center in Southern California.
Made me feel so good. In fact, I had tears coming out of my eyes. I thought, oh God, I wasn't sad, I was happy.
Oh, that's wonderful.
It was very peaceful and restful, and I enjoyed it thoroughly.
That's just great.
They make the patients feel so happy and more secure and just feel better about themselves. So it's not fun being in a bed.
No, it's not, is it?
No, and I'm a very active person, and to be laying down, it's not a fun thing, but the music is just beautiful.
The research that we've done at San Diego Hospice shows that the greatest benefit of HARP therapy is creating a calmness, less anxiety. And then secondly, it creates easier breathing. We use entrainment for that so that the doctors may say, somebody's short of breath, can you go in and help them to breathe a little bit easier? And then the third area that falls under our research was pain management.
In a survey of 182 patients, families, friends, and staff who were exposed to 20 to 50 minutes of live harp music in the Cancer Center at Massachusetts General Hospital in Boston, 81% reported increased relaxation and calm mood as a result of exposure to the music.
The National Standards Board for Therapeutic Musicians was formed in 2004 to create standards of practice for therapeutic musician training programs and their graduates. After the founding board completed their work on the formation documents, a new board was appointed in 2009. Reminiscent of Orpheus, Susan Raymond uses her harp to charm beasts of all shapes and sizes. She is a pioneer of harp enrichment for animals, specializing in pain management. She conceived her Pet Paws business in 1995 and began to document the effects of her harp music on animals. Her first visit was a pet store. She noted that within a short time after beginning to play, without exception, all the animals were asleep. Dogs, cats, and rabbits all snuggled down for a nap, while birds went to roost and fish rested at the bottom of their tanks. Now a consultant and lecturer for veterinary conferences and the U.S. Army Medical Research Institute for Infectious Diseases, Raymond has worked with African green monkeys, African gray parrots, and Alaskan wolves.